Hi everybody, Dr. B here. Welcome to our BEWL Podcast. Tonight we are fortunate to have Dr. Pinkas Lebovits, the owner, founder, creator of Park Plaza Dermatology. He is an old and dear friend of myself, my family. We love you, and we're going to pick your brain tonight. I hope that's okay.
Great.
All right. Dr. Lebovits, let's do some very quick questions. Fact or fiction? These are very popular topics.
Yes.
Accutane. Who should be taking it? Who should not be taking it? Does it work?
Accutane. It's a derivative of vitamin A. It's a good medication in the right hand, used by the right professional and used for the right person. First of all, can be used by people who have acne. Second of all, you have to make sure that what type of person is it, male, female, pregnant, not pregnant. In addition, you have to know for how long to use, side effects, and the dose. Okay, so you can develop, people shouldn't get pregnant on it, number one. Number two, they have to check their blood every month. Usually it's taken for 16 weeks. You can be on a much lower dose for a longer time. It may work, but it has to be adjusted by the doctor. It's very controlled, has side effects, depression, suicides. And you have to make sure that people are extremely conscious about the side effects, because it can develop dryness, irritation, and many other side effects. So, your doctor has to be your teacher, and at the same time, you have to be actively involved in what is told to you and follow all the instructions.
Can an older woman safely take Accutane? That's a menopausal woman.
You see, it's not so advisable because already they have a lot of other things, dryness, skin problems. Not all of them have, acne. You can use it, but what is older woman? You're not going to give Accutane to a woman with 60 or 70 years
Is it
old.
okay for, let's say, an older person to use it not on a daily basis, but once a week or twice a week?
No. It has to
A lot of people tell me they do that.
No. That's wrong. Usually you have to use a small dose. If it usually goes 1 milligram per kilogram per day, and you have a total dose lifetime, okay, you can go down and use, say, 10 milligrams a day, but you have to check still the blood test. Has to be registered. You have to sign a form which is called I Pledge, where you read all of this, get an approval, do your blood test, check if you're pregnant or not pregnant. It has to be even rechecked months after you stop using the medication.
I see a lot of young women who have terrible acne problems who would benefit from this medication tremendously. They are just terrified of using it. Should they be?
They should be careful. All the side effects have to be discussed, and they have to understand what they're doing. Being terrified and to know, it's another thing. When you have danger, you have to know how to avoid that danger. And, so knowledge is the key.
Great. Sunscreens.
Expensive
ones, cheap ones. What kind of SPF? Tell us what to do, please.
The latest, which we discovered, it's usually mineral sunscreens like zinc. Zinc-based or titanium-based are the best sunscreens. The only one side effect is that usually on people with darker skin, it leaves a grayish sheen. So, it's pasty. So you have to know how to apply it. Second of all, you can buy it with a little bit of coloring. Some sunscreen have coloring. Yeah, and the price for the screens, cheap or expensive, you have to understand less ingredients in the sunscreen is better. Because what is the difference between generic, and brand name medication? It's how many ingredients. If it's a brand name medication, usually they have not more than 5 or 6, ingredients. A generic have 10, 11, 12, 13. So zinc and titanium, you have to use it all the time. Second of all, it's different type of sunscreen. Some of them are good for children. Some of them are good for 4 to 6 hours. Some of them are good for 2 or 3 hours. You don't have to spend a tremendous amount of time, of money. It depends what type of tube you're buying, so the price will vary, but you don't have to spend $200 on a sunscreen.
What SPF?
SPF, usually SPF is 15 and higher, but on the average people
Is
go
the
between,
highest number the best?
Yeah, it's fine, but they may ask you, but usually between 30 and 50 is more than enough.
I hate putting sunscreen on.
Yeah.
But once I put it on once and then I go swimming, I hate doing it again. But my wife insists that I do it again.
Yeah.
Why?
Why? Because
Helps.
your problem is you're not applying the sunscreen correctly, okay? And this is in general. To understand that, the pea size amount usually will cover 200 square centimeters of space. So it means is 6 by 6 inches, so this space will be covered. So, a pea size amount, more than enough for your entire face. Second of all, liquid sunscreens, many times if you use them, they contain a lot of additives. I prefer, lotions. And in creams are okay also, but you have to really, spread it properly and to make sure that your skin doesn't feel oily.
Sprays okay?
They're okay. I do not like them as much because a lot of them, whenever you spray, you may see certain areas are sprayed, certain are not, and you will come out like a jaguar and stuff
I
like
hate
that.
sunscreen,
Yes.
but I do it.
Yes.
But
you have to do it, and if you take a swim, usually, every 4 hours, 3 to 4 hours, you have to reapply.
Okay, moisturizers, creams. Do I need the really expensive ones? Do the cheaper ones do the trick?
They will do the trick.
Guide me. Which one I buy?
Fine. Very simple. You see, the thing is, lotions are good. If your skin is not too dry, lotions are excellent. Legs usually because you put on socks, and arms they may require cream. Lotions and creams is better to apply after the shower when you use them. Again, small amount. Okay, people have super dry skin or have eczema. You can use a simple thing, coconut oil. But make sure don't break your nose whenever you're in the shower, so small amount. So it's very, very important. You go into a store and buy your coconut oil, natural coconut oil, and use it instead of going and spending who knows how much money. But, in general, lotions, say, you can buy a tube, for $10, $15, $20, is no problem. You don't have to spend $200 and to say that, it contains caviar. If you want to spend it because champagne or caviar champagne. Plus, make sure that those lotions and creams do not contain, additives like perfumes and stuff like that, because you may have an allergic reaction to that. So simple ones, from Aveeno, Neutrogena, Cetaphil, anything, whatever is inexpensive, and it's a good brand and a well-recognized brand is just fine. For very dry skin, you can use simply, like Aquaphor or white petrolatum, a small amount. It depends on the type of skin you have, lotions versus cream versus ointment, and the seasons you would have to change.
I have beautiful skin. I am blessed.
Yes.
Now, in order to keep this up and make sure that it doesn't go bad, do I have to drink 2 or 3 gallons of water a day?
2 or 3 gallons of water a day.
I see a lot of people doing that.
And, people do a lot of different things. You don't need to drink 2 or 3 gallons a day, but 4 to 6 glasses a day would be okay. But over that, I do not see the need of it. Don't forget, it's not only water, it's other things that you're using and consuming, which will be not only help you, but negatively affect you. All those cheap drinks, or colas or anything like this, or energy drinks, they may affect you not only about the volume of liquid you're taking, but, they may have some side effects also, in the long run.
Okay. And, I guess overdoing it with water can also cause severe imbalances with your sodium metabolism, can cause seizures and all sorts of neurologic problems. So we have to be really careful with that. But I will admit that if you come to my office, if you look underneath my desk, you will see about 15 bottles of Pellegrino there. And on a good day, if I'm behaving well, I try to drink 1 to 2 liters. And it feels good, and it helps me somewhat with hunger.
Yeah, but
I think more than that is overkill.
1 to 2 liters, you exactly
I think it's healthy. And I think it's healthier to drink something like Pellegrino or water rather than some kind of drinks that contain a lot of calories.
Let's translate it into ounces. So in reality, it would translate between 6 to 8 glasses of water. Okay,
right.
So you are in the norm. You are in the norm. You're not overusing. So let me throw something at you.
Sure.
How about Ozempic?
I think that Ozempic is a wonderful medication if used correctly, and if it is used under the supervision of a physician who knows what he or she is doing, who knows how to dose it correctly, who knows how to handle the side effects, and who knows when, once you've reached the effective dosage, to stop and not to go higher. Unfortunately, I have a lot of people who come to me and they say, I took Ozempic, it did nothing for me. And then when you question them more closely, they took the lowest dosage. Nobody ever told them that you keep going up on the dosage gradually until you hit your effective dosage. Or they took some Ozempic, they had some side effects, some common side effects, nothing even that major. So, some mild nausea, some heartburn, the feeling of fullness in their belly. And they say, well, as soon as I got those side effects, I was out of there. Those side effects need to be managed. Those side effects will disappear as you continue to take these medications. These medications are amazing because they help a lot of people. Of all the people who take it, if they take it properly, at least 90% of people benefit from these medications in terms of weight loss and in terms of improving cardiac parameters, high blood pressure, diabetes, issues with the heart, with heart disease. There are recent studies that have come out that show that these medications, by lowering their weight, they consider it to be weight or obesity to be one of the factors that are risk factors for heart disease, the same way as high blood pressure and diabetes are. So I think it's a great medication, but you have to take it the right way and you have to be supervised by someone who knows what he's really doing.
Another question, a lot of people for weight loss, they take stimulants. It's very, very popular, and you see these people going around, they may be skinny, but you see them jumpy, all their character changes,
Sure.
behavior and everything else, and they say they feel great, but you see that really something is going on. Should they take them? Shouldn't they take them?
So I think you're referring to medications like Phentermine or Qxsemyia. Let's discuss Phentermine. Phentermine has been around for decades. If used correctly, it's a very safe medication. I can tell you my own experience from Phentermine. About 7 or 8 years ago, prior to my neck surgery, I gained a lot of weight because I had to use a lot of steroids. And after my surgery, I took Phentermine for about a month. And I will tell you my personal experience with it. When I took it, I lost interest in food. Even if you were to put out a beautiful, delicious spread in front of me, I would have 3 or 4 bites, and then I would say, I'm good, I don't need anything else. I felt extremely focused. I felt like I was 18 years old again, and that's an incredible feeling for a man who's older. Mature, right? I personally had some issues with insomnia, a little constipation. During that month, while I was feeling good and younger and more manly, my wife said that I was angry all the time, and then after about a month, my hands started to shake. So obviously, because of the work that I do, I can't have my hand shake, and I stopped it. That was my personal experience. These stimulant medications, which are essentially legal speed, legal amphetamines, they are good for younger people. Obviously, they should not be given, in my opinion, to anyone over the age of 50. I don't think they should be given to people who have issues with high blood pressure. Absolutely no way should they be given to people who have heart disease. These medications can give you palpitations. They can really drive up your blood pressure. And if given to the wrong person, they can even provoke a heart attack. Now, having said that, if you give it to a younger person who does not have any of these issues, if they tolerate it well, it's a very highly effective medication. But even with younger people, we see that there's intolerance with some people. So some young people will tell me, I get terrible palpitations, or they'll tell me my anxiety is off the charts. Or with younger men, they say that they have issues with sexual performance. So if you take it and your health is appropriate to take it, these medications still have to be monitored by your physician, and if you have some of the side effects, they need to be stopped. Another variant of these medications is Qxsemyia, which is a combination of phentermine and topiramate. So topiramate is a drug that is used for patients who have seizures. It's a drug that's used for people who have migraines. And a happy side effect from topiramate is weight loss. Now, what was found some years back is that when you combine phentermine with topiramate, these two medications potentiate themselves. So instead of, think of it this way, instead of 2 + 2 = 4, when you combine these two medications, all of a sudden 2 + 2 = 20. And lower dosages of each medication are effective. Again, when used properly and when used under knowledgeable supervision, these medications can be quite good, but they're not for everybody.
You discussed these small facts and reality. I have one more thing, which crossed my mind at this moment. A lot of the younger generation are mostly sitting at home. They work from home. A lot of them are, sitting in front of their computers and gaining weight. And a lot of them are depressed, unable to communicate between each other and stuff like that. They go and visit their psychiatrist, and so all of a sudden they have weight gain, depression, and they taking antidepressant, and in addition,
Most of which make you gain weight, by the way.
yes, and plus they take stimulants. How do you deal with this? What to do? Just, in a short way, because, it's a very complicated problem which affects a lot of people, and this is the problem, generational problem. And what do you do with it? How do you deal? You don't go out, you sit at home, and you don't communicate. So all these things.
So I personally think that what in our generation was considered normal, in other words, you have to face some adversity in life, and you're going to go through events in life that make you extremely happy. You're going to go through events in life that make you a little anxious or depressed. And in our generation, I think it was okay. A little pain or a little suffering was okay. It was considered to build character and to make you a better person at the end. I think that in the current generation, anytime a young person faces any kind of adversity, whether it's minor or major, I think there's a tendency to throw drugs at these young people. I don't agree with it. I don't think it's a great idea. Clearly, some young people need drugs, and without the drugs, they will not get better. But I don't think 90% of them, medications. I don't think that 90% of the youth needs medications. Now, I will tell you that when a person is on medications for ADHD, something like Adderall, which is very similar to phentermine, at the same time they're on anti-anxiety and depressant medications. Obviously in these kind of people, you have to be very careful. Let's say if you're treating them medically to help them with weight loss, you have to be careful not to give them a medication like phentermine, because not only the phentermine and the Adderall will, add up to a crazy dose of stimulant, which may be difficult even for a young body to tolerate, number one. And number two, medication that's a stimulant like phentermine can make the anxiety and the depression much worse. You also have to understand that a medication like phentermine, when it is mixed with some of these antidepressants, it can cause a serotonin syndrome, and it can cause a whole new hurt that you didn't even imagine could be possible. So in patients like this, I almost never use these stimulant medications. It's important to understand the pluses and the minuses of these medications and to understand that they're not for everybody. We're not passing out juice. We're not passing out punch or water. You have to be very thoughtful how and when you use these medications.
That's true. It's meaning that we cannot put the same stamp on each person who walks into your office. So everybody has to be individually assessed and properly managed.
Absolutely. For some people, medications really help. For some people, if the medications don't work or if they don't work sufficiently, they will need procedures. Some people will need the non-invasive endoscopic procedures that I specialize with, but for some people that will not be enough, and for those people, that's why we have surgical procedures. It's very important to be thoughtful and not to apply the same solution to every person that you come across.
I would like to ask you a question. It's a lot of people are just taking the medications and they say, I heard this medication work. So what would you say that is a common medication that people think it works and it really doesn't do or is not as effective or is not right for people with weight problem?
Sure. So, for example, there was a medication that was very popular about 10, 15 years ago, Xenical. Essentially, the way it worked is it caused fat malabsorption. So the food that you were taking in, instead of it being absorbed, you would just poop it out. Now, theoretically, it sounds like a wonderful medication, but what a lot of patients would complain about was diarrhea. And what's worse is not diarrhea, but unexpected diarrhea. So where they would actually be incontinent of their stool while they were sitting there in their pants or their skirts, and all of a sudden they would realize that they had been incontinent. So that medication is almost never used. Another medication that many primary care physicians like to use for weight loss, metformin. I find that metformin really does very little for weight loss. Another medication that I find not to be very helpful, Contrave. I have colleagues who use Contrave all the time and they think that it's a great medication for weight loss. In my own extensive experience, I've tried this medication on my patients and I have not had any real success to report. What Contrave is, it's a mixture of two medications. Essentially, it's naltrexone, which is a medication that's used for people who have issues with opioid addiction. It's a medication that's used for people who have issues with alcohol abuse. And this medication is combined with a medication which is called Wellbutrin, which is an anti-anxiety and antidepressant medication that is very commonly used. And there are some studies that show that when you combine these two medications, there is some significant weight loss. Unfortunately, I have not been able to duplicate this weight loss in my patients. Pinkas, in recent times, my understanding of what dermatology is has really changed. Nowadays, when people talk about dermatology, all they're talking about is Botox and fillers. When a patient says, well, I recently went to see a dermatologist, you assume that they went there for some kind of an aesthetic procedure. However, in my opinion, dermatology is more than just aesthetic treatments. There are different aspects of dermatology: medical, cosmetic, surgical, dermatopathology. Can you tell us more about medical and surgical dermatology, please?
So, dermatology is a very interesting field. It's a field which requires a lot of understanding of a human body, and it requires a person to understand and to see what is going on with the person, because the skin is actually the mirror of your body. Looking at your skin, you can realize what's going on inside, and a lot of symptoms from the way your skin looks like, from the way that your weight is changing, or you have other symptoms, from color to the texture of the skin. and symptoms and different lesions on your skin, you can see a lot what is going on. For that reason, you have to understand that dermatology is not really cosmetics. Yes, we looked at dermatology as a cosmetic procedure, but it involves really understanding your own internal organs.
Would you say that dermatology is an extension of internal medicine?
Not only internal medicine, it's an extension of endocrinology, gynecology, gastroenterology, cardiology, hepatology. Any part of medicine is involved with some type of dermatological changes. So really, you carry everything outside your body. So by being a dermatologist, you are able, without really addressing many times a person, to realize what is going on inside, or at least suspect and direct the person what to do and how to deal with different problems.
Okay, that makes good sense. Let's take an example. Polycystic ovary syndrome, PCOS. I will tell you that most of our female patients have PCOS. Because of the PCOS and because of their weight issues, they have issues with fertility. What are the skin issues that you see in women who have PCOS, and can they be helped in any way?
It's a very interesting, problem which is reflected in certain symptoms. A lot of people who come to the dermatological office have a problem and they do not even suspect they have PCOS. Approximately 25 to 30% of women who have acne or some weight problems or some other issues, flushes, depressions and skin problems, and they think it's just a skin problem. So we always ask them, did they go to a gynecologist? Did they have a sonogram? Have they been checked for any, cyst on their ovaries? Do they have pains before their period? Most of them will say no or yes, and most of them will not even connect. So you always have to speak to them and explain to them that they have to visit a gynecologist and most probably endocrinologist, because their, say, weight issue or acne can be controlled, but not enough without the involvement of using certain hormones and additional things like birth control pills, spironolactone, and other medication which control acne. And at the same time, they will have to, in addition to all of these other things, due to the fact that they say have weight issues and stuff like that, they will have to see a gastroenterologist, and after that, to decide, or a nutritionist, and to see what really is going on with the body, with the weight issue, and the same skin issue.
So many of the female patients that we have who have PCOS, they come to me and they're already on medications. Oral birth control, as you mentioned, spironolactone, which is also a diuretic that we use in patients with liver diseases, and they're also on metformin. I think it's controversial how much these medications help PCOS, but in your opinion, do these medications help these women who have issues with their skin or with acne?
They help, but really they are not the cause of the problem. Like the craze now with all this medication like Ozempic, right? Weight reduction and stuff like that. It will not work well because you still have the problem with your ovaries and cysts and everything else. You have to take care of that. Yeah, your weight may fall, but in reality, you're not taking care of yourself. So a lot of them will require, additional things, in addition to their taking, birth control pills, spironolactone, and taking care of the ovaries. And in addition to doing all these kinds of things, they can be helped with, other simple procedures which are offered by gastroenterologists and which can be explained to them, by specialists like you. Because, people take things as particles. you cannot look at the body as just, say, an engine or, the body of the machine. You have to look at it as the entire mechanism is working. So you really have to combine different things to be able to control your weight and what procedures are right for you and what has to be done. Was your expertise, say, in weight loss and procedures that you're doing, you can encompass and explain and provide them additional help to understand how to control this part of the issue that they have with PCOS.
So what we are seeing with our weight loss procedures, whether it's the intragastric balloons that we use, we have the Orbera balloon, the Spatz balloon, and with the Suture Sculpt, which is the endoscopic sleeve. When we do these procedures on our patients, they are an excellent way of effectively losing weight. So we see that their insulin resistance improves significantly. We see that many women who've had issues with fertility, with conceiving for many, many years, we see that when they lose the weight, all of a sudden they're able to conceive. And this would also include women who've done IVF treatments unsuccessfully in the past. When they lose the weight, they are able to conceive. So, but my question to you is, do you see with women that have dermatologic problems because of PCOS, do these problems get better with weight loss after our procedures? Or if they don't, what do you specifically prescribe for them? Because our appearance is very important to every single one of us.
So the thing is, it's a few things that have to be taken care of, because it's two aspects, say, of the procedures that you are providing to the patients. Number one, the old-fashioned procedures that you use to reduce the weight, where you had a reduction of the stomach size and everything else. We see at the present moment, lately, I see that people had procedures like done 15 or 20 years ago. They have a lot of gastroenterological problems, okay? They come back and it's a lot of side effects. Was the newer procedure, and especially was the procedure that you are, providing to a lot of your patients, is much more advanced, is simpler, and it does not really destroy the function and the ability of your body to respond to the weight loss the way it has to be done without interfering with the entire GI system and ability to control the absorption and the absorption of all the foods and vitamins and everything else, versus the older procedures, because the new procedures, you can reverse them. The older procedures, you can't reverse them, okay? So we see that. So, it's a lot of people come in, they have tremendous amount of problem and dermatological problem also. So the older procedures, they make the condition worse. In the beginning, they lost the weight. Maybe they improved because they used the hormones and everything else. But a lot of women, who are older, who are closer to menopause and everything else, all of a sudden they develop the new problem, which is related to the surgeries that they had many, many years ago. So the advances in gastroenterology and the newer procedures are tremendous. So, and again, people have to understand really what is the right thing for them to do. Just to use the diet, or to use Ozempic, or they need to use hormonal treatment, and what procedure to do to lose the weight.
So I agree with you. With the older surgical procedures, whether it be the gastric bypass or the laparoscopic sleeve gastrectomy, the big problems that come up with those procedures are things like severe acid reflux. You can get the dumping syndrome, specifically more so with the gastric bypass. You get malnutrition. You get malabsorption of vitamins. None of these concerns come up with our endoscopic procedures, because when I do the suture sculpt, for example, I only work on your stomach. There is no dumping syndrome because by definition, Dumping syndrome is something that only happens with surgical procedures where the gastric transit is accelerated. But the main mechanism of our procedure in the suture sculpt or the endoscopic sleeve is that we delay the emptying of food from the stomach. So our procedure is not going to give you the dumping syndrome. Because I only work on your stomach and I don't do any work on your small intestine, we don't have any issues with absorptions of nutrients, vitamins, minerals. With our procedure, you will never get malnutrition, and our procedure will never give you issues with acid reflux. So I think that you make a very, very important point. So a person has done my procedure.
Yes.
She's lost the weight.
Yes.
She's tremendously happy, but she still is having issues with her skin. How can you help her?
Okay, that's a very interesting question. Everything depends on the age. What symptoms did the patient have prior going to you from the dermatological standpoint of view? And what else has to be done? And plus you have to take into account what GI procedure was done. So with the old type of a procedure, when you have malnutrition, malabsorption, not enough vitamins, not enough minerals, you will develop a lot of problems all over your body. From simple dryness, a loss of collagen, a loss of sugar of the skin, elasticity of the skin, all of those things will require a lot of, help from the dermatological point of view. But again, this will depend a lot, in addition to all the things that we're going to be using, to see why it happened. If it happened because of the procedure, they may need, if it's possible, a reversal or nutrition or hormones. And plus, in addition, we would be able to provide them with additional, oral or topical medication depending on what the problem is. For acne, you can use, the medications. For
Accutane.
Accutane is not really for this. It depends if it needed to. It's a lot of other things. If the person has worsening of eczema, because some people come in, they're overweight, they have eczema, they have diabetes and stuff like that. So all of those things will have to be worked in combination. So depending, if you have very big laxity of the skin, you may require, certain procedures, like, from collagen to injectables to PRP to using, additional vitamins and minerals which will help out the nutrition of the skin. So all of those things will be individualized. You cannot combine all of this, together, or say have the same prescription for different ages, different problems, and different procedures which were done, okay? Or additional issues that the person has because he or she gained weight or lost weight and stuff like that. So all of this is a combination. So dermatology is a mirror of your body. So we would assess it and individually provide, or just maybe procedures, or maybe just using medication or supplements or creams, ointments, and all other things which will be needed.
So obviously, nutrition affects our skin. Nutrition is extremely important.
Yes.
In the health of our skin. What would you say? Which foods are bad for your skin and which foods are wonderful for your skin?
So, depending, as you know, it's a lot of different myths, but at the same time, you have to know, you deal a lot with reflux and stuff like that. So, foods like, spicy food, tomatoes, all those kinds of things can make your skin worse, or can make your skin worse. And usually what you have to eat, you can eat depending on what you are used to, because some people are vegetarian, some people are pescatarian, some people eat, like meat and stuff like that. So yes, you have to have an equal balance of protein, and depending what type of protein you're eating, you have to be able to use the right mixture of spices, and diminish the amount of salt you're taking, and enough vitamins, like for example fruits, vegetables, all of those things, improve the skin, from leaves, green leaves, and different type of nuts, mushrooms, all of those things will improve the condition. But for this, you would have to have a workup. Some of the products, like say oranges or citrus, can cause allergies. A lot of additives have allergies. A lot of additives. So natural products, which are not raised, by giving the animals or the fish hormones or some other additives, they will be absorbed by the animals or the fish. It will negatively affect your body, and if your body is affected, your skin will be affected.
A very big concern that our patients have is loose skin after a weight loss procedure. So developing loose skin is very common after a surgical procedure, be it a gastric bypass or a surgical sleeve. And over there, the way I explain it to patients is the reason that happens is because they will lose 100, 150, 200 pounds sometimes in 6 months. And that's a real shock to the body. With our endoscopic, non-invasive procedures, it can happen, but it is distinctly unusual. And I think the reason for that is because our weight loss is more modest, number one, and number two, it's more gradual. So let's say loose skin happens with a patient, regardless of which type of procedure they use. Do you think that they should immediately go to the plastic surgeon to have a paniculectomy? Or are there non-invasive ways to tighten their skin that you would that are effective?
First of all, the best thing is prevention. And what does it mean, prevention? If you gain 30, 40, 50, 60 pounds, do not wait until you are overweight, 100, 120 pounds. It's much more difficult. The shock on your body is much more difficult. To avoid the loose skin is more difficult, because what you do, you have collagen. Collagen is like rubber, and if you stretch the rubber, or say you put the rubber into the sun, whenever you try to stretch it, it breaks. When the rubber is broken, you cannot put it together. So it's very, very difficult. You will require surgical procedures, big procedures. But if your skin is just stretched and is slightly stretched, and you do it on time, you do the procedure where the reduction is modest, you lost 40 or 60 pounds, and all of a sudden you're doing fine. All those things can be reversed and improved by using certain lasers, certain injectables, and stuff like, and radio frequencies, and all these kinds of newer procedures that people are working on, and plus some injectables. They can improve and tighten your skin. Because you not only want to tighten your skin, you want to have some regenerative process to get your collagen working again and being produced, so your skin can have a better elasticity and turgor. It's a lot of things are done now. Nothing is perfect at the present moment, but all of those things in combination between just procedures and proper care from all the sides, not only dermatological side, but endocrinological, gastroenterological side. All of this will give you a chance to recuperate much faster and to have the result that you desire. If you let things simmer and your body is already not in a stage where you can reduce 20 or 30 pounds and it's over 100 pounds, as I'm just repeating myself, it's much more complicated. So you can stretch the skin, you can take out the skin, but you will not recuperate the collagen that you lost.
That makes a lot of sense. Let's say we have a patient who unfortunately did not do the prophylaxis, did not do the preventive work. And here we are after a large amount of weight loss in a short period of time. She presents, she has developed loose skin. Who should see you first, the dermatologist first, before going to the surgeon? Or should this always be the process that you should be the first person who is seen to map out a plan, a battle plan for that patient?
Okay. I agree with your assessment of the issues that you're dealing with, but I would like to just to point out certain things. Age makes a big difference. Younger the person, faster the person starts, easier to retain and recuperate the collagen, elasticity, and turgor. With age, you lose already those factors because, menopause, hormones, all these kinds of things already affecting your body, your skin, your body, and everything. So later you start in life, to do all of these things, we can do it, but not as effectively as you do it whenever you're younger, because all the procedures, all these things that has to be done, they are easier on the body, and the effect at the end is much more visible.
That makes a lot of sense. I'd like to shift a little bit and discuss the fact that many people don't realize that dermatologists also deal with hair loss. Now, I realize it's too late for me, but when a person has done a procedure and they've experienced some hair loss from a weight loss procedure, what can be done short of a transplant? What interventions can you do? Medication, any other treatments that you can offer?
It's a very broad question, extremely broad. It's one problem, but very broad question. Do we have definitely an answer for all of the hair loss problems for men and women? Say, for women, for example, you can have hair loss from a lot of different things. Pregnancy, birthing, say a thyroid problem, which can affect men and women, stress, heart condition, a liver problem, GI problem, all those things can affect it. So it depending on what's happening. Say, let's take a pregnant woman, right? A pregnant woman, first of all, during pregnancy, women in general gain weight. That's nature. Okay, they gain weight, gave birth to the child. What happens? During that time, they don't watch their diet as good, or eating maybe something not right. Not the right products and stuff like that. They gained weight, but at the same time, they lose hair. And the hair loss can be from small to very extensive. You can have so-called alopecia totalis or universalis, or you can have alopecia. And alopecia means hair loss. Hair loss can be patchy or overall generalized hair loss. Plus, if your hormones are changing, you may have change of hormones. You may have the imbalance of male and female hormones. Depending on that, you may need certain hormonal therapy. Otherwise, it's a lot of things which are available now. As we know, it's things like pills, minoxidil. How was minoxidil discovered? In Brookdale Hospital, they had a patient who had a kidney problem, and he was given minoxidil for high blood pressure. All of a sudden, after, I don't remember, 4 or 6 months, his hair grew back. So this is how it was a side effect of medication. So what they did, they started to use minoxidil in the liquid form. Okay. First of all, they used it, just for a while, and a lot of men used it, different percentages and stuff like that. After that, now we use minoxidil in pills. We start with a low dose, like 2.5 milligrams. It's a blood pressure medication, so and it works well. Or we use medication like Propecia, especially in men. It's usually medication which shrinks the prostate, and a lot of men after a certain age develop enlarged prostate, which is practically affects most of the men. And, it's the same medication, but it's much lower dose. Whenever you give it, a lot of people, retain, gain back, the hair. Another thing, many times you have to see if it's enough vitamins, so you can use vitamins, for hair, nails, and
Do
skin.
they work?
Yeah, they do work.
Favorite hair vitamin?
Nature made Nutrafol. Nutrafol is much more expensive. It's a very good
Nutrafol
one.
going to help me?
No, it will not. Too late. Because your hair follicles are gone and stuff like that. So you will have to play Kojak for the rest of your life. If people know, if people know who Kojak was,
I'm sure my children don't.
It's okay. So now they have a homework.
Yul Brynner.
Homework.
Okay.
Yul Brynner, right.
Now you have Michael Jordan.
Yes. So, and after that, they have newer procedures, like PRP. Whenever you take blood from your arm, you spin it, and you re-inject your own things, and it has very great results and improvement in people. We can see it, and it's very, very, very effective. But you have to understand, it's effective if you did the full workup for the patient. You have to do a workup, because people with thyroid problem, say hypothyroidism and stuff like that, they may, lose the hair. And you try to do all of these things, and the thyroid is not checked, and it's not normal, it will do nothing. It will do nothing. So you have to really understand why you have hair loss. Stress. From stress, you can lose patches of hair, which is called alopecia areata. You have to make sure it's no fungal conditions over there and stuff like that, because the hair can be lost because of different, fungal conditions. You can have it from cyst and infection and folliculitis, which destroys the hair, because you have developed channeling under your skin. So it depends what type of skin problems you have. Plus, you can have different other problems when the sulfa binding, things in the hair, they are not good, and the hair breaks off. The hair would never grow, would grow a centimeter or two and break off. So you have to really understand what is the hair loss. You have to evaluate it, see what is going on, and, we are on the way of discovering more and more newer treatments for hair loss. Will it help universally everybody? No. Can you retain them? Most probably yes. And again, you have to start it timely and to see what really is going on. Sudden loss of weight will definitely add to the problem. So again, we're going back, from the procedure to your nutrition, to types of medication or procedures which has to be done, and you will be able to regain and regenerate everything. And the hair, you may lose the hair on the scalp, on the eyebrows, on the body. It depends how your body is responding to the stress and everything else and the conditions that you have.
So our family experience with the prostate medication that you mentioned, Proscar or finasteride, was when my father, who was in his early 70s at the time, he started taking medications to shrink his prostate. It was Proscar, which is exactly the same medication that's used for hair, finasteride. And all of a sudden, after a few months of taking the medication, he started growing jet black hair. And at the time, we were not aware that this was a side effect of this medication, and we were suspecting our father of having done something behind her back. But the poor guy never did anything behind her back. It was a side effect of this medication. The question is this. A medication like finasteride, would you say that it's safe to use? We know that it's safe to use in older men, especially, who have prostate enlargement issues. So the two questions that I would pose to you, is a medication like that safe to be used in women of any age? And in addition, is it safe to be used in, let's say, young men? Let's say in their late teens, early 20s, early 30s. Is it a safe medication to be used?
I think it has side effects, yes. And usually we always talk about side effects, okay? is number one, mood changes. Number two, the movement of the sperm is much slower, okay? And usually, we did not recommend for women to use it or touch it and stuff like that because, of the side effects. So,
What kind of side effects would a woman have?
it would affect their, endocrinological things, so and stuff like that.
So not for women.
Yeah.
Is it okay for young men?
Yeah, but you have to tell them about the side effects.
So if, let's say, and I remember I personally started to notice that I was losing hair when I was 17 or 18. At that time, none of these medications existed. But at that age, I would have been very eager to use a medication like this if it had been around. What kind of precaution should a young man take if he wants to take these medications?
First of all, officer has to be careful, make sure that, try.
Should they be doing sperm analysis medically?
It's not really the sperm, it's the movement, movement of the sperm. In addition, they have to see because, some teenagers, they're affected psychologically badly. So you have to be careful. And all these things, so you cannot just do it like this. Now they use a different type of, medication called dutasteride, which some people consider a little bit more effective than.
Okay. Some of the concerns with minoxidil. Number one, is minoxidil safe to be used in both men and women?
Yeah, you can use it, but the formula for the women is slightly lower. You can use it the topical, and the oral one. You always, if you have cardiological problem or some other problems or blood pressure, just consult your PCP or cardiologist, to make sure that everything is okay and your blood pressure is not jumping.
So I remember one of the first things that I learned when I was doing my internal medicine residency was that if a patient was on minoxidil, it meant that his blood pressure was really resistant to medications. How do you prevent, let's say if your dermatologist prescribes to you minoxidil for hair loss, how do you prevent or how do you guard against that certain patient's blood pressure from plummeting unexpectedly?
For this, you actually monitor. You just simply monitor it, and
you start with a tiny dose.
They usually start with 2.5 milligrams. That's it, and that's what you keep. But in reality, it should not affect so much, because the dose is very, very low. Mm-hmm. So just as has to be adjusted because, as you know, for high blood pressure, you use combination different medication depending on the problem you have. So because of that, you may involve, again, I'm repeating myself, cardiologist or PCP who's checking your blood pressure and stuff like that. And especially, it may not work as well in older people. It may work much better in younger people and stuff like that.
Okay. How about dry scalp?
Dry scalp. Okay, dry scalp, it can be 300 different, 300, but the thing is different conditions. It's actually the most common condition is seborrheic dermatitis, which collection of flakiness. Your hair is becomes dry or too oily, and the skin is usually changing. And the problem is that some people develop this flakiness on the scalp, on the eyebrows, around the nose. It's called seborrheic dermatitis. This is why people use Head and Shoulders or another over-the-counter medication called Neural. Some of them you need to use steroid solutions to control it. A lot of times we use antifungal for, they work for seborrheic dermatitis. Now a new non-steroidal medication came out specifically for seborrheic dermatitis. So we see new developments. And all of this can affect the hair loss also. Because why men lose hair because of the androgens, which is the male hormone. Whenever it's discharged and you have a lot of oil, it's activated by the oil of your skin and it kills the hair bulb, and it suppresses and you lose your hair. So by keeping your hair fresh and reducing the inflammation on the scalp, may improve the growth of your hair and retain it. Plus, you said, I started to lose the hair when I was age 18. So It's not a genetic problem, it's a familiar problem. So you may skip generation, so certain people will never lose hair, even say 90% of the male relatives have hair loss, and you may just have a full head of hair, and some people don't. So
is it a myth that if you're going to lose hair, it's whatever your father's side of the family, whatever their history was? Is that a myth?
No, it's a familiar problem. It can be from the man's side and woman's side.
Or woman's side.
Yes.
Okay. It
It's
doesn't
not
discriminate.
Genetic.
Does not discriminate.
No, no. It's a genetic problem. In different races, different types of hair, you have, different type of hair, curly, thick, thin. So it's always may be affected and has to be treated slightly in a different way. So, you have to take in the race and ethnicity into consideration, because, you have to deal with all these problems slightly in a different way. From hair styling to hair products, so all these kinds of things have to be understood, and you cannot apply the same prescription to everybody. Yes, we're a human race, but each person is different.
Do hair dryers make it?
It's a bad.
Are they bad for your hair?
Yeah, because hair dryers, they break
I remember I
hair.
used to have an afro when I was young, and I had to use a hair dryer.
Yeah. So first of all, hair dryers dry out the hair, right? Because and they break. The hair breaks. So hair dryers are very bad. You should use always a shampoo and a conditioner, depending, it's 20, 30, 40, 50 different types of shampoos. You can buy them, by different companies. You don't have to go and spend on shampoo and conditioner $100. You can spend $5, $7, $8, and that's it. Just take a look, they're all similar. The base of the shampoos is similar. It's superficial, it just, makes your hair a little bit more manageable, but really, it takes out the dirt and the bacteria and the dead skin. So, it frees the hair from being destroyed and stuff like that. So you don't have to spend hundreds and hundreds of dollars.
Thank you. I always enjoy spending time with you. Tonight was no different. I learned a lot. I thank you very much. Dr. Pinkas Lebovits, the greatest dermatologist in New York City, the founder of Park Plaza Dermatology. I hope to see you soon. And when we meet next time, I'm going to pick your brain even more and about newer topics.
Great.
Thank you very much.